I'm really excited about our speaker today. I don't know if anybody's paid attention to the calendar, but today is an infamous day in the world of substance abuse. 420, which is a kind of a it's Christmas for marijuana users, so let's just call it what it is. So, kind of a national holiday that's recognized all over for marijuana use, and so I wanted to do a marijuana special on 420 because I didn't want to miss that wonderful opportunity that our meeting date fell on 420. And so we have got Greg Stutmiller, who is an LPC and an LADC from the Tulsa area. I will let him talk more about his practice and what he does, but he's going to provide us with some really good, up-to-date, and modern information about what parents need to know about marijuana. So, Greg, you are up.
Tell me, can you see the presentation?
I can.
Awesome.
It's a little glary because of how I'm doing it, but we're good to go.
We're good?
I think so.
Okay. So we're talking about marijuana. I'm excited and honored to be the official 420 speaker. So about me, I'm a licensed professional counselor and a licensed alcohol and drug counselor. I have a private practice in South Tulsa. I've been working with people with drug and alcohol issues for about 12 years now. I enjoy doing so. So let's talk about marijuana. The first thing we're going to talk about is the rules and regulations regarding marijuana in the state of Oklahoma. I have this slide, so the Wild West of weed. It's kind of a joke, but not really, because as we'll see, the regulations or the laws for medical marijuana use in Oklahoma are very loose. So we'll start with marijuana in Oklahoma is regulated by the Department of Health through the Oklahoma Medical Marijuana Authority, or the OMMA. So here are some rules if you are a physician and want to recommend marijuana to a patient. And I say recommend because one of the issues with marijuana not being federally legal, you can't prescribe it. It's not a prescribed medication. You can't just go pick it up at a pharmacy. It's through the dispensaries. So if you want to be a recommending physician, you need to have a license that's in good standing. So an MD or a DO in good standing can register as a recommending physician. And that's really all you have to have. You don't have to have any special classes. You don't have to have any certain certification or anything like that. You just have to be a physician in good standing. So how do you know, if you're a doctor, how do you know when to recommend medical marijuana? So according to the OMMA, when recommending a medical marijuana license, a physician shall use the accepted standards a reasonable and prudent physician would follow when recommending any medication to a patient. So basically it's just saying use your best judgment, which that's pretty loose, that's pretty vague. So there's not a lot of real strong guidelines on that, as you can see. An interesting rule here, a doctor cannot have the same address as a dispensary. The reason I say that's interesting is because if you talk to people with medical marijuana cards, a lot of them, probably most of them, did that process at a dispensary. I'll tell you guys a story. One guy I talked to who has his medical marijuana license, he explained to me how he went about that. He walked into a dispensary, a local dispensary, and said, "Hey, I would like to get a medical marijuana card." The guy behind the counter, who was not any kind of medical worker, not a doctor, not a nurse, not anything like that, just the guy who works behind the counter at the dispensary, hands him a form that has some demographic information at the top, like you might expect, and then just a list of symptoms, and gives that. And my guy I was talking to, he fills out the top part, puts in his demographic information, and then he looks at this list of symptoms or illnesses and decides not to mark any of those. And what he told me was, he said, well, I hadn't been diagnosed with any of those things,
So I figured I probably shouldn't indicate that I had any of those. And just to caveat, this guy that I'm talking about, he's, a guy in his late 30s. He's in good shape. He exercises. He's pretty healthy. He doesn't have any, medical conditions that he's concerned about. He really just wants to smoke marijuana. So he doesn't circle any of those symptoms on his form. He gives it back to the guy behind the counter. The guy behind the counter looks at the form and says, "Hey, you have to circle one of these," and gives the form back to him. So he gets the form back and he circles insomnia and anxiety, and then gives the form back to the guy. They tell him, "Okay, just a minute." A couple minutes later, he's in a room with an iPad. There's a doctor on the other end of the iPad, doing like a Skype or Zoom type thing. The doctor says, "Okay, it looks like you have insomnia and anxiety. I'm going to recommend you have a medical marijuana license. Don't smoke too much." And he said that was like the entire thing. The whole thing took, from start to finish, he said less than 5 minutes. They explained to him the process. He paid whatever money he had to pay, and he was done, and he got his card. So I tell that story for a few reasons. One, to show how lax the process is, and two, to explain this rule here. A doctor cannot have the same address as a dispensary. So the doctor cannot have an office within the dispensary. However, the doctor can absolutely be prescribing or recommending to people from the dispensary using that kind of technology, using video technology, whether it's, Zoom or some kind of other software. And that happens all the time. So once a person gets recommended medical marijuana, their license is good for 2 years in most cases. There are exceptions to that. For example, if a child, someone underage, has a medical marijuana license, that's not good for 2 years, and there are other exceptions. But generally speaking, a license is good for 2 years. So that's the physician rules. The rules for the dispensaries, the OMMA calls it a commercial establishment license. So if you want to open your own dispensary, you have to be 25 years old. There is a background check. You cannot have a violent crime within the last 5 years. You can't have a non-violent crime in the last 2 years, and you cannot currently be incarcerated when you make application. You can't have any kind of potential conflicting interest. Basically, you can't be an employee of the city in which you're trying to get the commercial license. So you can't be a sheriff, a deputy, a police officer, a prosecuting officer. You can't be employed by the OMMA. You can't be employed by that municipality. So say, you're the comptroller in Broken Arrow. That means you can't open a dispensary in Broken Arrow. You can open a dispensary in Jinx or Owasso or Tulsa, just not in Broken Arrow because you work for that city. The commercial establishment license is good for 12 months. It's only valid for one location. So when you see these places where, the same person or the same company owns more than one dispensary, that means they had to get a license for each of those locations, and those locations have to be renewed every year individually. If for some reason you lose your commercial establishment license, you have 30 days to move your inventory either to another established, licensed establishment, or to dispose of your inventory. So if you are one of these companies that owns more than one dispensary, you could move all your inventory to your other dispensary, or you could move your inventory to one of your competitors, work something out with them, or you can just dispose of your inventory, and there are all kinds of creative ways in which you could do that. So those are the rules for the dispensaries. And then the rules for the individual person, so the consumer. So how much marijuana can I possess if I have a medical marijuana card? And this is where it gets really exciting if you're a fan of marijuana. So an individual can possess 3 ounces of marijuana on their person. So to explain that, so 3 ounces of marijuana is the equivalent to, it's 85 grams. If you're looking at serving size for marijuana, I would say it's a gram is a pretty standard serving size. So basically that means I could have 85 blunts on my person. 85 is a lot. 85 blunts on my person at any time. You can have 8 ounces at your residence. So you can do the math. If 3 ounces is 85 grams, then 8 ounces is, I don't know, somewhere around 200, I guess, something in that ballpark. So again, a lot. You can have 6 mature plants. So those are plants that are producing the flower, the bud, the part that you can ingest. And then 6 seedling plants, so plants that haven't flowered yet. You can have 1 ounce of concentrated marijuana, so that would be like wax or oil or something like that. You can have 72 ounces of edible marijuana, so gummies, brownies, cookies, whatever. And then here's the best part. So this is a direct quote from the OMMA. These possession limits are cumulative, and a licensed patient or caregiver may possess at one time the totality of the items listed in this section. So what that says is if you have a medical marijuana card, you can have a bunch of marijuana in your possession at one time. So, and it's worth noting that if a person is smoking marijuana, they can smoke it pretty much anywhere you can smoke tobacco as far as the, state laws are concerned. Now, establishments, private businesses and things like that can do what they want, but, I'll give you, an example. So one of the guys that lives in my neighborhood has his medical marijuana card, and he sits on his patio every night and smokes marijuana. I go out and walk my dogs in the evening, and I frequently, when I go past his residence, he's sitting out front smoking marijuana, and it's perfectly legal. It's because, he can smoke it there. It's his home. There's nothing anyone can do about it. So, so all that to say, as far as the legality of marijuana, it's pretty wide open. If you have a card, you can have a lot of marijuana and use it in a lot of ways, in a lot of places, and it's pretty easy to get that card. So some other things that are good to know when it comes to marijuana, some of the effects of marijuana. And a lot of you are probably going to know a lot of these already, but I think it's worth going over if you're trying to decide, hey, is this person high? Some things to look for. And specifically, I should point out, these are the effects of THC, okay? So there's different chemicals in cannabis plant. THC is the one that's most famous. It's where all the high comes from. So those effects are, hypoactivity, so slow, moving kind of slow, acting kind of slow, heart rate goes up, spatial impairment, verbal impairment, sedation, lower blood pressure, bloodshot eyes, dry mouth, some of the mental effects, it affects your short-term memory, it can mess up your perception of time, it can cause psychotic symptoms like hallucinations, can increase levels of anxiety and just general intoxication. So when you think of, the effects of marijuana, typically what you're thinking of is the effects of THC. CBD is the other chemical that's in marijuana that is most well known. CBD is interesting. CBD doesn't have a lot of those same effects. It doesn't get you high. It doesn't have the psychoactive properties that THC has. In fact, it appears to block a lot of the effects of THC when you take them together. So some people, like using marijuana with a higher content, a higher CBD content, because it helps level out some of the effects and makes it a more pleasurable experience. CBD by itself seems to be beneficial for some people in terms of helping with anxiety, decreasing psychosis, helping with sleep. It seems to help with inflammation and pain. So, there do seem to be some benefits for CBD, and that's, why you see a lot of an increase in its popularity. I think it's pretty important to note that you hear people talk about different strains of cannabis a lot. This strain helps with this, and this strain helps with that. It's important to know that that's not real reliable information. For one, when it comes to those names, they can be a little problematic. You might think, for instance, that two similar names are going to have similar effects. So you would think Purple Kush and Master Kush are going to be similar in their effect because they both have Kush in the name. But that's not necessarily the case. That's just the name that whoever developed or whoever bred that strain of marijuana chose to use. It doesn't mean it's going to have the same effect. Another thing to keep in mind is that ideally, if I buy Purple Kush in dispensary A and I go to dispensary B and buy Purple Kush, I'm getting the same thing, ideally. And, a lot of the time that's probably the case, but sometimes that's not the case. Because this stuff is unregulated. There's no, it's not like the FDA is making sure that everything's on the up and up when it comes to marijuana. So you could go to dispensary A and get Purple Kush and then go to dispensary B and get Purple Kush and get two different plants because no one's really regulating that. So another thing that's important to know is when it comes to the actual DNA of the plant, there's no such thing as like a pure sativa plant or a pure indica plant. And sativa and indica, those are the two most common types of cannabis plant. Generally speaking, people associate with sativa as kind of the head high or the one you do for more creativity, the one you do in the day. It's like your wake and bake marijuana. Indica is more the body sensation, more of the sit on the couch and eat Cheetos and do nothing kind of experience. A lot of times people will use indica in the evening to relax. And you hear whether it's a dispensary or wherever, they'll say this is a sativa, this is an indica. The fact is there is no such thing as a pure sativa plant or a pure indica plant. Those probably existed at one point in time, but those are long gone. Every strain that's out there now is a hybrid to one degree or another. It's, part sativa, part indica, but you can't get the pure thing on either side. So really when they label a plant a sativa plant or an indica plant, really that has more to do with the plant's physical characteristics and the effects that it has on the person, not so much the actual DNA of that plant. So really, if a person is thinking about different cannabis strains and how it's going to affect them and what it might help or not help and that sort of thing, the best thing to do is to think in terms of THC and CBD content, not so much is this a sativa or indica or what is this called? Is this Purple Kush, Master Kush, whatever? So that's the strains. Yeah. So potential medical benefits. So at this point, it's really clear that there are some medicinal benefits to marijuana. We'll talk about that. So some of the benefits that have been shown through different research studies. It seems to help with sleep quality, especially with people who have chronic pain. We already mentioned that CBD seems to be helpful when it comes to inflammation and chronic pain. Cannabis can be effective in treating glaucoma. It can be effective in treating muscle spasticity, so people with muscle spasms. It can help with nausea. It can help. Now, the slide here, it says, has been shown to reduce cancer cell invasiveness. Now, if you talk to marijuana, enthusiasts, sometimes you'll hear them say that marijuana can cure cancer. That is completely false. That is not a true statement, and anybody who's relying on marijuana to cure their cancer is going to be in big trouble. What this says is that at best it might slow down the spread of cancer. It's not going to stop the spread even. It might at best slow it down. So if a person has cancer and they're using marijuana as part of their cancer treatment, they're not curing their cancer, they're not stopping their cancer. At best, they're slowing down the spread, and then they're also probably help treat some of the symptoms of the cancer and the treatment of the cancer. It also seems to help with seizures. That's a common use. When you see cannabis use in kids, usually it's because of seizure disorder, because it can help with seizures and preventing those. So those are some of the benefits, but obviously there are also some potential medical problems. First of all, cannabis has a lot of the same issues as smoking does in general. Smoking anything is bad for your health. I've heard some of the stoner lore out there as people say that, well, smoking weed actually helps because it opens up your lungs and blah, blah, blah. That's all false. That's all nonsense. Smoking is damaging to your lungs. Smoking marijuana is just as damaging as smoking tobacco. You have tars, you have carcinogens, the plant material, all that can be inhaled and cause problems. Using marijuana can increase the risk of heart attack or stroke. Because it can increase your heart rate. Now, I will say that doesn't mean if an average healthy person smokes marijuana, they're going to have a heart attack. That's not true. What it does mean is that if a person already has problems with, heart problems and, blood pressure problems, increased risk of stroke and things like that, and it's not being medicated and they're not managing those, then marijuana can be risky for that person as far as their heart goes. We've already mentioned some of the short-term physical effects of marijuana. It can negatively interact with other medications and other drugs, so that's something to keep in mind. If someone's on medication for something else, that can be a problem. Use in pregnancy. Again, a lot of the risks that come with smoking cigarettes in pregnancy apply to smoking marijuana during pregnancy. Also, it's worth noting that cannabis use during pregnancy may affect the child's mental development, may affect their ability to pay attention and to learn later on in life. Another thing that's important to keep in mind is that a mother or a father for that matter, a parent who's using marijuana when they have an infant, a small child, when you're high, you just don't respond the same as if you're sober, So it seems like it should be common sense that if a person is high and their child is having an issue, they're not going to respond as well as if they weren't high. Now that gets a lot of kickback from my experience when you're talking to people who really are into smoking marijuana. But it's just a fact. I mean, we already talked about, being high on marijuana, it affects your reflexes, it affects your cognitive abilities, it affects your ability to move quickly. So all those are important when you have a young child. As far as use in childhood and adolescence, definitely it's not good for a developing brain to use any kind of substance, marijuana or otherwise. It can, stunt that development process. One of the things here, the second little bullet point here, 1 in 6 people who use cannabis before age 18 will become addicted compared to 1 in 10 who use after age 18. So earlier use means more likelihood for developing a problem later on. Also, there seems to be a correlation between early cannabis use and psychosis in adulthood. And that's going to lead us into the next thing, which is there definitely seems to be a correlation between marijuana use and psychosis and schizophrenia related disorders. The endocannabinoid system that's in your body, that's in all of our bodies, and the cannabinoid receptors that's in all of our brains affect the same parts of the brain that are, involved in psychosis and schizophrenia. So there's been studies that show that people who use marijuana, particularly if they use higher potency cannabis or for longer durations or for greater frequency, seem to be more likely to have an episode of psychosis. There are some definite risk factors to pay attention to. Family history of psychosis is a big one. We know that things like schizophrenia and those kind of disorders often seem to run in the family. So someone with a family history of psychosis is going to be at greater risk of having, like a cannabis-induced psychosis. Also, presence of subclinical or undiagnosed psychotic features is a risk factor when it comes to using cannabis. You're more likely to have psychosis later on. And then, of course, if someone's already been diagnosed with schizophrenia or schizophrenia spectrum disorder like schizophreniform disorder, schizoaffective disorder, delusional disorder, schizotypal personality disorder, all those would be a higher risk for experiencing psychosis if they were using cannabis. So, for instance, if someone's on medication, say someone's been diagnosed with bipolar disorder with psychotic features, and they decide, I'm going to get off my bipolar medication and just use medical marijuana, I think that'll help. For that person, that's probably a terrible idea, because they're increasing the likelihood that they're going to have psychosis, and they already have a history of psychosis. So that's something to keep in mind if you're talking. If somebody says, I'm going to quit my SSRI that I take for my depression and use medical marijuana to help my depression. Now, I'm not going to say that's a good idea. In fact, I would say let's talk about that a little more. But my reaction is going to be less strong than if someone says I have schizophrenia and I'm going to quit taking my schizophrenia medication and just use medical marijuana. I would just be very blunt with that person and tell them that's a bad idea for more psychosis. So let's get to marijuana and addiction. So the first question, the question you always hear people debate, is marijuana addictive? Marijuana is absolutely addictive. It has, the potential to cause, dependency, physical and psychological dependency. How do we know that? Well, because you can have withdrawal symptoms for marijuana, physical and psychological withdrawal symptoms. They're not as pronounced. It's not the same kind of withdrawal that you would have if you were coming off of heroin, for instance, or alcohol. Those are much more severe, but it doesn't mean they don't exist. People coming off of marijuana often have increased anxiety and mood issues. They're often more irritable, angry. A lot of times their appetite is affected. A good way to think about withdrawal symptoms in general when it comes to any substance is a lot of times it's the opposite effect of the high. So, if a drug makes you eat more and chill out, then getting off that drug makes you eat less and be more agitated. That's a pretty good rule of thumb. There is diagnostic criteria for cannabis use disorder in the DSM-5. You can have mild, moderate, or severe cannabis use disorder. So somebody who would qualify for moderate or severe cannabis use disorder, I think you could argue is addicted to marijuana. And we already shared the statistic that 1 in 10 people who use marijuana will become dependent. That's 1 in 6 for those who use prior to age 18. So it's definitely an addictive substance. Just because it's not as severe as some of the other drugs doesn't mean it's not addictive. And I just realized I'm over my time. So I'll save the arguments for or against cannabis in recovery for the discussion.
Awesome. So flipping back over to me real quick, and I'm going to start my video on Zoom so that people on Zoom can see me there. Thank you if you're watching on Facebook for sticking with us. I appreciate that. I know this was a little bit different than usual. Here's what I want you to do is I want you to go, if you're interested in our discussion, to our Zoom room where that discussion is going to be happening. I'm going to write the Zoom ID in the Facebook comments right now. Zoom ID 957-5182-0839. So that is in your Facebook comments. I'm also going to give you the password to that in your Facebook comments so that you can go join us there for the discussion. I'm actually interested to hear more about the arguments for or against that stuff in that discussion. If you are watching on Zoom, thanks for sticking with us there.